How's that?
Yeah.
Okay.
Go ahead.
Good. All right. Good morning, everyone. Welcome to Brockton Neighborhood Health Center. I'm Sue Joss. I'm the CEO here. And I'm really excited to be hosting this press conference on such an important topic. Lead poisoning got a lot of media attention when Flint, Michigan's water supply was contaminated. And it's great that they've got that water supply back to normal levels. But in many other communities, including Brockton, the lead contamination levels in some areas of the city are just as bad, if not worse, as they were in Flint. So it's bittersweet to get a grant like this because the sad thing is that we need it, but this is a preventable condition that we really have an obligation to address for our children. Dr. Dolan, who you'll hear from in a few minutes, was just over at Good Samaritan visiting the 10 babies who were born to our patients in the last day or so. And those 10 babies deserve a chance. They deserve to live in a community, where, in a home where they can grow up healthy and not have to worry about their lives being altered by something like lead, which is totally preventable. So I'm really excited by this grant. And especially want to thank Mayor Carpenter and his staff for really taking the advocacy lead on this issue and going for this grant and really advocating for increased resources and commitment to this problem. So with that said, I'd like to ask you all to welcome our Mayor, Bill Carpenter.
Well, good morning, everyone. It's great to be here with you at the Neighborhood Health Center, and Sue, thank you so much for hosting this announcement this morning. You will hear about some partners of the BRA in terms of administering this grant and making sure that we can get these grants funds to the folks that it's intended for. And I just want to mention those organizations, silly some of them that are here this morning. NeighborWorks is here with us this morning. We've got some folks from NeighborWorks. Brian Moriarty is here. We also have Self-Help is here. Jonathan Carlson and Chris McCain are here representing Self-Help. Those will be the organizations that will actually be working directly with the homeowners and assisting them in completing and submitting their applications for this funding. So we appreciate their role. The last time, Brockton in the past did receive some HUD federal funding for lead paint abatement for low and moderate income families, but that funding ended over 5 years ago. And for the past 5 years, there has been no federal money coming into the city to help with lead paint abatement, even though, you know, this city has one of the oldest housing stocks in the state, and that's where the lead is found. Houses that were built before 1970, particularly World War II era housing, is typically full of lead. So priority will be given in this program for the areas where high numbers of pre-1970 homes with families, with children exist under the age of 6 who have tested positive for lead poisoning. And this is why, and we'll get the doctor up here in a minute, that the Neighborhood Health Center is such a key partner to us in making this program work, that you know, they're in the business of identifying and helping the families whose children do test for elevated lead levels. The Brockton Redevelopment Authority will utilize its resources to determine the housing units where children are at the greatest risk for lead poisoning. The grant is $2.7 million. We'll get into that in a minute, over 3 years, but there's also some additional money in the grant, Healthy Home Supplement funding, and that'll be used to assess housing units with additional health-related hazards. So the total money coming from HUD on this program is $3 million. And then the city has a match using CDBG funding through the Brockton Redevelopment Authority of another $277,000. So there will be over $3 million distributed to Brockton homeowners over the next 3 years to help us abate lead paint, specifically targeting the most at-risk children in the most at-risk neighborhoods. We also have, I mentioned the Neighborhood Health Center, and also BAMSI is another agency that will be helping us locally. Brockton is, by almost any measure, one of the cities in Massachusetts with the highest rate of children with elevated lead levels. And we're actually third highest after Boston and Springfield. And Dr. Dolan was explaining to me a little earlier, and she'll talk about this, that as of 2012, they've actually lowered the threshold for what's considered elevated lead, and we're not even including those children in our stats. So the risk and the need is even much greater than the numbers that we used in our grant application. We're told, and when we do the research, that there are some census tracts in the city where the incidence of children with elevated lead levels can be as high as 10% of the children. Not citywide, but in certain sections of the city. And Sue mentioned Flint, Michigan, and all of the billions of dollars and the national attention, as deserved, to get a proper water supply to the families in Flint because of elevated lead. The incidence of elevated lead readings in children in Flint, Michigan is 5%. So we have neighborhoods here in this city where the problem is just as great, if not even a little greater. So this really is a critical need, and it's a critical threat or risk to children who are growing up in the city.
And he was right up front with Senator Markey that coincidentally we didn't get funded, Malden did get funded.
Senator Markey's hometown. Yeah.
And he was very upfront that Brockton needed this funding because this is about Brockton's future. It is about Brockton's children. The fact that lead has a detrimental effect on kids or children, the most vulnerable population in the city. I remember when we first started this with Paul Amano, and we did this grant, and then we reached to Sue and several other partners throughout the city to see how we can actually put together an application that we knew would get funded. Once again, it was Paul Amano, our office, working with Sue, getting consultations with Sue, Neighbor Works, a number of other entities, just getting consultations so that we can actually demonstrate and see the numbers. With that said, this is going to be like the mayor indicated, this is a negative, but it's a positive. The fact that we got the funding back, and over the next 3 years, we can actually make some inroads into the housing stock. We also do the housing rehab program. I'm excited that we do have someone here that's a recent home buyer to the city of Brockton. The mayor's going to introduce her. She'll tell you, we have a lot of old housing stock. It's not like the rest of the nation or the Northeast. Our housing stock is old. A lot of it hasn't been rehabbed. We get calls every day through the homeowner rehab program. This is going to be a good thing for the city of Brockton and for the future and the people who are looking to move into Brockton. With that, I'd like to thank you, Mayor, especially. Great.
A lot of people in Brockton came together to get the lead levels down in the 13 years that I've been working in downtown Brockton. The lead levels have improved, but we have a lot of work to do. There's so many old houses in Brockton, especially in the downtown area. Actually, some of the statistics say 83% are built before the mid-70s. And if you don't rehab the buildings correctly and get rid of the paint, it's still there for the babies. In 2016, about 1% of the children tested for lead had a level over 10, which doesn't sound like a lot, but that's 43 children. And the vast majority are our patients here at the health center. In 2012, the CDC had lowered actually the lead level we worried about from 10 to 5. So if you add those children in from 5 to 9, that's another 4%. So we're talking at least 5% of the children who, in this community, and most of them are in this downtown area, are being exposed to lead. We don't know all the effects of lead under 10, but it's a toxin and it's in their brain. And children start, crawling around, putting their hands in their mouth as toddlers and infants, and brain growth is so important in the first 2 or 3 years that any lead, even a little chip of paint, can raise their lead level. So we would love to get the lead level as low as possible, and certainly want to get those children who are over 10 But that 5 to 9 range, we're very aggressive about following our children. Our children are tested every year, starting at the age of 9 months, and we follow them very closely. Unfortunately, when they're in these low levels, what we call low levels under 25, there's no treatment. The treatment is to get the lead out of the house. And there's no medication, we just have to follow them slowly, make sure that they reduce the risk of lead levels by cleaning their house and giving the child a good diet, but the key is getting the lead out of the house. What happens to children with lead? There have been a lot of studies on lead levels, and certainly kids with very high lead levels, like over 25, can have headaches and can get very anxious. So I've seen some children around 20, very irritable, anxious, poor eaters and everything. But even those children in the 5 to 20 range have issues. It affects their brain. And we can't always see what the effect is until they're about 4 or 5 years old. When they start going to school, we can test them. But we see lower IQ points, so kids can have lower IQ points, 2 to 3 points, maybe up to 7 points, compared to other children without high lead levels. And we're comparing children who are also living in the same type of community. So it has an effect on them. They have learning disabilities, trouble reading, trouble concentrating. A lot of kids have like attention issues and hyperactivity. We don't see those right away. We see them throughout the school year. They also have a higher chance of not graduating from high school, and some studies have said they've had a higher rate of delinquency. So this toxin that our children are being exposed to in the first couple of years of life can last forever. And we want our children to succeed in school. We want them to have a good outcome. As I said, a lot of children can have a lot of attention and hyperactivity. We can make it very difficult for our parents to work with them. So I do have children who have been exposed, not high levels. We're talking 15, 11, but you think, oh, that's not too bad. It's not too high over 10. They have IEPs at school. They have behavioral problems, speech delays, learning problems. So this is a profound effect on children throughout their lifespan. So
for months to try to find a perfect home. Finally found one, and when we got the paperwork that it was built in 1900, it was a problem for me. Because at first I was, if you can't produce me a lead paint certification, that means there's a problem. Seeing that my youngest daughter is on an IEP plan, I was very concerned. After moving in, we called the inspector to get the home inspected because I want a multi-family unit. When it was inspected, he came back and said, your first floor is a high level, it's a high risk. When it's being done, you need to vacate the premises. And your second floor is at a low risk, but still need to be wiped. So in my head, I'm like, oh my God, this is getting expensive. Not to mention any other work that we had to do in order to move in for us to be comfortable. So after calling around, getting different inspectors, getting in different contractors with license to figure out how the price was really high. Something that a new homeowner does really not want to pick up, especially if you're thinking about your mortgage, you don't have a tenant, all that. It just got overwhelming. So I did a few research. I called a couple places. I ended up reached out to Laura's office and found out that you guys recently just got approved by the federal in order to get the grant. Excitement. I was happy because I'm like, yes, I can finally apply for something. Someone will be able to help me. But my main concern was that I was relieved that at least there is some form of resources that I'd be able to take advantage of as a new homeowner. And I'm really happy that it's here because being able to have a home that's built in 1900, not only does the insurance company ask a ton of questions, but as a homeowner, you walk around and you see different areas, you see different items, and being inside your home, reading over the inspection report over and over and over, you're like, okay, don't put nothing in your mouth, be very careful, calling a pediatrician, can I get a lead paint test in? She's like, don't be alarmed, it's, just calm down, do the necessary steps that's needed to get it out the home. Once my home is de-leaded, then I'll be relieved. And that's what I'm thinking. Mayor Carpenter, I'm thinking the redevelopment office, I'm thinking everyone that was a part of making this dream come true, because not only does it gives me a sense of relief, but I'm still happy that I can be comfortable in my home and not be a risk, you know?
Awesome.